Hello, welcome to Smart PT. My name is Jonathan Reimer. A lot of clients have soft tissue injuries. We know that they will initially present many times in the clinic in the inflammatory phase where there's lots of pain and discomfort. At some point though, they start to come out of that inflammatory phase and the pain and discomfort starts to reduce. Many clients think they're better and they start to become active, often resuming their regular activities much too quickly. So what I tend to try to do is preemptively stop that process. I educate the clients during that early inflammatory phase that what's going to happen, that they're basically going to start to experience a significant reduction in pain, but that does not mean soft tissue healing is sufficient or stable enough to start progressing and loading too quickly. So instead of having that cycle where a patient starts to feel better, goes back into activity too quickly, re-aggravates back to square one, I try to circumvent that process, educating them ahead of time what's going to happen. I let them know that soft tissue healing studies show that, in order for tissue healing to become fairly stable, it takes about 6 to 8 weeks following significant sprain or strain injury, and can take substantially longer to fully complete the healing process. So making them aware of what's to come is so important in preventing the typical re-aggravations. When they come out of that inflammatory phase, we talk about the graduated loading of tissues. Tissues respond very well to loading, but it has to be managed properly. We go to the gym to strengthen, we overload our tissues in a smart way generally, and we prevent injury, but build up greater strength. The same thing can be done for injury. It just has to be done properly, and you have to take into account the whole cumulative effect, what they're doing at work, what they're doing recreationally, what they're doing at home, to prevent the significant overloads. So sometimes if people are very, very active already in their work and recreational activities, they may not be good candidates for lots of additional exercises. If they're more sedentary, then yes, you can start to improve tissue loading through an exercise program. Anyways, that's my take on soft tissue repair and how to prevent the cycle of continued aggravations with your clients through appropriate education. Have a good day.